Hello everyone, this is Dr. Nima and this is our lecture for Dentition for Dental Science, Chapter 4. We will talk about, it's a short lecture. The main thing about that is the teeth numbering systems and how would we describe the teeth in the dental office. Instead of using the long names, we usually use numbers. So that would be the main focus on this lecture. And also we'll talk about a few things here and there about the eruptions of the teeth and the timing for that and the quadrants and some of the other things, a few things like the dental formula. Okay, so this is something that we talked about before, but it's always good to have an introduction. So definitely you know that dentition is what we describe the natural teeth in the dental arch. So we say, let's say we say primary dentition and we say permanent dentition, and what we mean is all the teeth that are in the arch. So we know that the upper arch is the maxillary arch, the lower arch is the mandibular one. So here we go, mandibular and the maxillary. And the maxillary arches. So maxillary teeth and mandibular teeth. We know that the permanent teeth, which are the adult teeth, are 32. And we know that the baby teeth, we call them primary or deciduous, and they are 20. Okay. We talked about sextaneous teeth in the previous lecture. Sextaneous teeth are the adult teeth that will replace baby teeth. So the only ones that are non-sextaneous are the molars. Why? Because when these permanent teeth are erupting, so central, lateral, canine, and then premolar, first premolar, second premolar, they're replacing all the baby teeth that were here that were also central, lateral, canine, and first and second molar on baby teeth. So the permanent molars that would replace, the permanent teeth that will replace the existing teeth, these are the sextaneous, and again they are the central, lateral, canine, and first and second premolar because they actually replace that tooth. And then the non-sextaneous teeth are the molars because they do not replace anything. They just come on their own space because the jaw would enlarge or expand as we grow, and there will be space for them to fill without having to replace another tooth. So a term that we call mixed dentition is when we have both primary and permanent teeth in the same time in the mouth at the same time, and we'll see these periods of teeth growth. So this is just a picture technically to show you a little bit of how the sextaneous teeth are coming up. You can see these are the primary dentition. This is all the primary dentition, the baby teeth, and then we have the permanent dentition coming up, and you can see all of these teeth are replacing other ones. So these are the sextaneous teeth, while the molars are not replacing any teeth, so they're erupting on their own, so we consider them as non-sextaneous teeth. Okay, and again that's for the permanent dentition. Moving on, we have technically three spans of eruption. Eruption meaning the growth of the teeth. So we have a span where we have only primary teeth in the mouth. We have a span where we have mixed, and we have a span where we have only permanent teeth in the mouth. So with only primary teeth, that is, and usually the time span is like almost like a 6 and a 6. So like 6 months to 6 years, 6 years to 12, and then from 12 and all the way on. So from 6 months to 6 years. So this is when the first tooth would erupt at 6 months, and the first tooth that will erupt is, so the start of this period, when we say, well, we're starting the only primary teeth period, is the eruption, which means the growth of the primary mandibular, central, incisor. These cute teeth that babies always have, right? I'm drawing a cute baby here. So these are the cute teeth that they have, and these are the first teeth that will erupt in the mouth at all. Like these are the first teeth, the mandibular primary, mandibular central incisors, right? These are the first ones. So from 6 months to 6 years, there are no permanent teeth. You have just all the way until 6 years only primary teeth. They start adding up as we get to a year and a half, and so on. And then about 2 years and a half, that's when you have all of your primary teeth, and you keep having them until 6 years. Around 6 years, and definitely, people are different. Some people would have them a little bit earlier, some people have them a little bit later, but that's not a problem. We're talking in general. Around 6 years of age, that's when we start having our first permanent tooth. So this is the start of the period. The first permanent tooth, which is the mandibular first molar. That is the first permanent tooth that erupts. The mandibular first molar. And the mixed dentition keeps on going until age 12. So from 6 to 12, the mouth, the arch, the mouth would have both primary and permanent teeth. That's why we call it mixed dentition. So we'll have these, and the teeth keep growing and growing as we keep erupting and erupting for permanent ones until we get all of the deciduous teeth falling, and that is when we have our permanent only period, and that is when the last permanent tooth, the last primary tooth, would fall, and that's why we call it exhalation, and that's like the fall of the primary teeth. So the exhalation of the primary maxillary second molar, that is the last primary tooth to fall mainly, and that's at age 12. So these are our periods and mix in of eruption, and just to know mainly when do they start, when do they end, and what marks the start of the period. Okay, moving on. There's something again to be able to describe things. We divide our arches into quadrants. So each arch would be splitted by a midline. And since we have 2 arches, that means we'll have 4 quadrants. And these quadrants, sometimes when we talk, especially when we do, let's say, cleaning, we tell the patient we're going to work on 1 quadrant at a time sometimes, because it's too much for them, so they can eat on the other side, and so on and so forth. But anyway, it is the same for the permanent and primary teeth. All of them have, each dentition have 4 quadrants. So you start with the first one from the right, so the maxillary right quadrant, then you go to the side to the maxillary left. So we always start from the right, because this is the right of the patient, this is the left, and then you go to the mandibular left quadrant to the mandibular right quadrant. And same thing with the baby teeth. These are the quadrants that we have, and there are 4 quadrants. And again, these are used mainly for description, like we describe some things, or we work on 1 quadrant at a time, and so on. Okay, we have what is called dental formula. It's not that much used, maybe only for describing some things. But this is mainly, it's an abbreviated method to express the number and the type of the teeth on the maxillary and mandibular arch. The way that this actually does, or describe the teeth, so technically we're taking one side of the arch, of both arches. So see, this is usually also the left side. So we're looking at the left side, meaning that we're actually looking at half of the teeth, right? Only half of the teeth. So usually when we count these, we have to multiply them by 2 to get the total number of the teeth. And we'll see how actually we use them. And this is also a dental formula that's not only used for people, but is used for mammalians. So any mammalians, animals, we can use that, as you will see in the examples that we'll have in a second. Anyway, it's a way to describe it. So as we said, it's on one side, 1 maxillary and 1 mandibular quadrant. We said that the quadrant is half. Okay, so here, if we're taking an example for the man, the person, like us humans, we have 2 incisors, 1 canine, right? We have 1 on each side. These are 2 incisors, 1 canine. We have 2 premolars, right? These are the 2 premolars. So here, let's do this as 2. And then we have 3 molars. Definitely, you know, I don't have a third molar here, but so I have also 2 here, 1, and then another 2, and then another 3. And technically that's how we write it. So if you add these up, it will be 16, and then you multiply it by 2, and you get the 32. So let's see how we actually write this down. And again, this is for description purposes. The way that it is written down, there is a specific order. So we replace the teeth names with letters. So I for incisor, C is for canine, P is for premolar, and M for molar. So these are the teeth, and again we do it on the left side, looking at the left side as you can see in this picture here. And like we did, same thing. So the way that we're going to do it for permanent teeth, you have I 2 by 2, which means 2 on the maxillary arch and 2 on the mandibular arch. So the number before the slash is for the maxillary, the number after is for the mandibular. So here, canine, we have 1 and 1. Again, same thing. So we write it this way. See, we start with I and then C and then P for premolars, and we have 2 on the maxillary and we have 2 on the mandible. And then we have M for molars, and we have 3 and 3. And that's our formula. And you can see it equals to 16, so if we multiply it by 2, we'll get 32. And again, because sometimes we cannot write it like in this way, we can write it just like with a slash, same thing, so it works the same. There's nothing here in between the teeth, between the letters, so just the way that it is like here. We can also write a deciduous formula. So it is the same. As you can see, we can just write it the same thing. For deciduous teeth, we have technically 20. So we know that this equals to 10 multiplied by 2 equals 20. Right? We have 2 centrals. So technically 2 centrals, 1 canine, and then 2 molars. That's the deciduous teeth. So we can write it this way, or we can add the D to it. So we don't have to write deciduous. We can just put DI and DC and DM and so on and so forth. So we know what we're talking about is the deciduous dentition, not the permanent dentition. Okay, moving on. This is what an example is. And again, this is for reference so you can kind of have an idea. So let's say for cats, you'll see that this is the deciduous because start with a D. So they have 3 incisors on the maxillary, 3 incisors on the mandible. They have 1 canine on both maxillary and mandibular. For the premolars, they have 3 premolars on the maxillary and 2 premolars on the mandible. For the molars, they don't have any molars, and that's the amount of the deciduous teeth. And then their permanent dentition and so on and so forth. So you can see again, the D is for the deciduous, and without having the D is for the permanent. Again, this is just an example for you to see what are these things, how we use the dental formula. Okay, now entering the numbering system. So the numbering systems are important for us, very important to understand and know. And these are because, again, this is how we're going to describe teeth from now on. When we talk about the central incisor, for example, maxillary right central incisor, instead of saying all of that, we say number 8, tooth number 8. And again, there are different numbering systems, but they have 3 ones. Let's say here, you have 3 numbering systems that we'll go to. So you have the universal, and you have the Palmer, and you have the FDI or international. The universal is the most used one in the United States. That's the one that you need to focus on and to know exactly and memorize the teeth like you know your name. It will take a while, but with a lot of repetition, you will definitely know these teeth, and it's super important. Again, this is super important to know your teeth. Palmer is usually used by orthodontists, and it's actually much easier than the universal, but you'll see. And then FDI is usually used internationally, like in Europe and something like that. And we'll go to each one of them one by one and see how do we name our teeth. So, starting with the universal system, again, that's the main one that is used in the United States that you need to focus on and know. We use numbers for permanent teeth and letters for primary teeth, right? And we start from the right side, I would say maxillary, right side, and then go clockwise, right? So you see that here we started with the first one, number 1, which is the maxillary third molar. And then we have number 2, which will be the maxillary second molar. And so on and so forth. We go until here. This is the maxillary central incisor. And then we move on all the way to 16. That will be, oh, sorry, this is more important, maxillary right, right, right. And then we switch to the left side. So this will be the maxillary left third molar, and so on. Then we jump to the mandibular teeth. So let's say this is 17, 19, 18, 19. That's 19 is the mandibular left first molar. And then we move on. This is the midline, and then we switch to now mandibular right, and so on and so forth. So these numbers will go from 1 all the way to 8, 9 to 16. So that's the maxillary arch from 1 to 16. And mandibular arch is 17 to 32. So that's what we use here, again, because we said we use numbers for permanent teeth. For primary teeth, we use letters. So we start with A, again, same thing, maxillary right. We start with always the maxillary right. That's what we start. And then we move on all the way to J, which is the maxillary left, and that's, again, that's the second molar, because we don't have third molars on primary teeth. We go K all the way to T, and that is, again, so with the left second molar and with the right second molar. So that's what it is about. So you start, again, permanent teeth are with numbers from 1 to 32. You start with the maxillary right third molar, and you end with the mandibular right third molar, right? As we said, we move on. For primary teeth, we use A to T, and then again you start with the maxillary right deciduous second molar, and you end with the mandibular right deciduous second molar. Let's see here. I gave you more, bigger picture here. And what I do usually, one of the tricks that I use to kind of remember things easily, I remember my canines, because the canines kind of in the middle, right? So if you know your canines, you can know some of the teeth that are on each side. And I'll tell you why canine are easy to remember, because there are 6, 11, 22, 27. So it rhymes. Canines are 6, 11, 22, 27. So 6, 11, 22, 27. So when we talk about tooth number 30, you remember that 27 is a canine. And you kind of count or imagine your way around, after the canine. What are the teeth that comes, right? You have premolars, and then you have the first molar. Or maybe we do tooth number 25, and you have 27 before, after that, which is a canine. So 25 is central incisor. So I think knowing the main things like the clock, right? When like you have 12 and 3 and 6 and 9. So you kind of know everything in between, when you first learn how to read the clock. It's the same thing here, 6, 11, 22, 27. The other things that definitely you should know, 1, 32, 16, and 17, because these are the third molars. These are the end of everything, right? Here and here and here, the last teeth. And it's good to know 8 and 9 and 24 and 25. So if you know these, this will help you a lot with your permanent teeth, for the universal numbering system. Again, 6, 11, 22, 27, and then you have 1, 16, 17, and 32. And if you can remember the 8 and 9, the 24 and 25. as I was saying, practicing is the key. I mean, there is no other way other than practicing. You have to practice more and more, and I'll give you some resources that you can work with. For baby teeth, sometimes I guess it's harder with letters. Some people might be better with letters than numbers, and so on and so forth. But anyway, what I remember are also the canine, and this one is a little bit easier because you have only 20 teeth. So canines are C, H, M, R. And when I say it's charm, that is, these are my canines. My canines are my charm, although they're not like in the right order here. CH, it should be MR, but you know, just to remember. So charm, and again, when you have a D and then you know that C is a canine, you know what D it is, like it's a lateral on the maxillary right, and so on and so forth. So I hope that this helped. It helped me because the way that I used to, you know, I'm a graduate from a foreign country, and we use Palmer method, as I will show you in a second. So this was a little bit challenging when I started, but again, with practicing and having this, it helped me a lot to start memorizing them. And the more that you use them, the more that you memorize them, definitely. And again, I'll give you something to practice on, you know, some resources that will help you with your practice. And just to confirm, you know, again, when you describe a tooth, if I ask you about tooth number 3, you have to say it is permanent, maxillary, right, and then the tooth name. So permanent or deciduous, maxillary or mandibular, and then right or left, and then the tooth name, which is the first molar, and so on and so forth. Like here, 13. So it would be maxillary or permanent, maxillary left, second premolar, right? And so on and so forth. So this is super important, again, to understand and to know. And these are hopefully will be helpful for you to practice. The second numbering system that we're going to talk about is the Palmer notation system. And again, as I said, it's mainly used by orthodontists. This is easier. Why? Because first, you only have to deal with 1 through 8. You don't have to deal with 1 through 32 like we did with the universal system. How does that work? It starts from the middle instead of starting from the right. See, the other ones start from the maxillary right. This one starts from the middle in each arch. And the numbers keep repeating themselves. They keep repeating themselves. So number 1 is always a central incisor, whether it was maxillary or mandibular, left or right. Number 2 is always a lateral. Number 3 is always a canine, and so on and so forth. 4, 5, 6, 7, and 8. So we go this way, and we go that way, and we go that way. So you only have to memorize 1 through 8, technically, right? 1 is the central, and 8 is the third molar, and you're good to go. Now, how do we say that this is the maxillary right or maxillary left? By using the brackets. So when they write this down, they write it this way. Let's say this is the maxillary, right, because it's facing up, and right, because that's the right of the patient, and then you put the number here. So if we put maxillary right 3, that means, if we put this simple, that is the maxillary right canine. How about if I give you this one, and then number 2, what is that one? You can pause. This is the mandibular left lateral incisor, and so on and so forth. So again, the brackets are the one that that will help. So sometimes they'll say orthodontists usually extract number 4 on both arches, so they can put 4, 4, 4, 4, and that means that number 4, which is the first premolar, right? The first premolar on each arch that needs to be extracted, and so on and so forth. Or it can be just on the maxillary, or it can be just on the mandibular arch. So these brackets are really, again, I think it's an easy system once you know your right from your left, and then you can just use the brackets as, for that. So we still use numbers for the permanent and letters for the primary. So now this is the permanent 1 through 8. The primary teeth, the baby teeth, we have A through E. So from A to E. A is the central incisor and E is the second maxillary, or doesn't matter, not maxillary, sorry. The second molar, second deciduous molar. So again, if I would give you this here and I put C on it, what is that? That is the maxillary right canine. And you know it's deciduous because I used letters, right? So you have to do deciduous or primary maxillary right canine, and so on and so forth. So how about this one here? And maybe B, right? That is the mandibular right or deciduous mandibular right lateral incisor, and so on and so forth. So you can see again, and where it starts, where it ends, or it starts or where it ends. So again, this can be easy if you just know your teeth, and remember that it has numbers for permanent and letters for primary teeth. Again, I put more for you so that you can take a look and see. And now we have the last one, which is the FDI. Technical difficulties. The last one is the FDI. So the FDI, which is, or what we can say, the International Numbering System. And FDI stands for Fédération Dentaire Internationale. I think we mentioned that before in one of the lectures. But technically, it is really similar to Palmer system. So in the way that it starts from the middle, the center, and it goes to either way. So same thing, the same 1 through 8. If you remember these, then you're good. 1 is central incisor, and 8 is the third molar, again for permanent teeth. And now instead of using the brackets, we're using numbers for the quadrants. So how is that? How does that work? So what they did is they named the first quadrant, the maxillary right quadrant, as number 1. The maxillary left is 2, and mandibular left is 3, mandibular right is 4. So if I want to mention this tooth here, which is the canine, which is number 3 on the maxillary right, I would put 1, 3. So you read 1 as if it's the quadrant and 3 as if it's the tooth. If I put 4, 3, you know that 4 is the quadrant, which is this quadrant here, and 3 is the canine. So this would be the permanent mandibular right canine, and so on and so forth. So that's the way that they use it. And again, start from the center and goes to the sides. The other thing is on the baby teeth we have number 5, 6, 7, and 8. So number 5, 6, 7, and 8, this is what we are going to mention. So instead of putting 4, if I put 5 and then put 3, you know that this is the canine. So for baby teeth, they're also still using the numbers instead of letters. And for the quadrants, it's 5 through 8. So again, if I put 8, 1, you know that's the baby teeth, deciduous, and 1 is the tooth, which is the central incisor. So you have to notice the number before, because this would give you, is it a permanent 1 through 4, or is it primary 5 through 8. I gave you more examples here, and this at the end also is a great tool for you to know all of these in one place. So universal, Palmer, and FDI, and the teeth names on all of them. This one, just don't worry about this, because this is just an extra thing. You don't have to worry about this line. But again, you have the universal, Palmer, and FDI for the primary teeth.